Hi, and welcome to this installment of Frank and Mary here in Hudson. If you have not seen this show before, my name is Art Bergeron. My day job, I'm an elder law attorney at Myrick O'Connell. But this is not about my day job. It's about my friends Frank and Mary. If you've been to the Senior Center during one of the many seminars I did, or doing some of the ones that I'm now doing virtually, you know what I'm always talking about, Frank and Mary, and their goal in life, which is to live in their house until they die and be buried in the backyard. And if they're in Hudson, that means Hudson. They don't want to go to Marlboro. They don't want to move with their kids in San Diego. They want to be right here. So the question is, who are the people you need to know, and what are the programs you need to know about in order to continue to stay right here? So I finally was able to convince my John Parent, one of your selectmen, who has been a great co-host for the last several months. So I've been really pleased to have him here. And we've been kind of talking about the kinds of guests we've wanted. And this week, thank you, John, for coming back.
My pleasure.
And this week we got a terrific guest. You want to introduce our guest? Because we're going to talk about stuff that's relevant right now. Medicare re-enrollment time right now. So John, who do we have?
Yeah, this is great. Two really valuable employees from the Senior Center. We have Holly Richardson, who is a social service advocate. And we also have Ana Salomao, who is a bilingual social service advocate. And they're here today to talk about some of the SHINE program issues and more specifically Medicare Plan D programs. So I don't want to take any time away from them. They have valuable information. So I'll turn it over to Ana.
And so Ana, and I know that Holly, I guess Holly can't make it, but Ana, can we kind of talk about, well, just to kind of pick up on what we were talking about before the show? You, as you mentioned, you're typically see about like 300 people during this Medicare re-enrollment time, and can you just speak for folks who aren't used to doing it regularly, right? What the reason is why a lot of those people are regulars that you see. You know, it isn't because they all forgot from the previous year. There's actually a reason, right, for why they want to be talking to you again.
Yes. So basically, the basic reason you want to look at your health insurance during the open enrollment period is because things do change from year to year. There could be slight changes, but you always want to make sure people do get in the mail from their plans what the changes are for the next year. But most people pick up that package and like, oh, package, I'm fine with what I have. I don't need to read this. You can have changes to your formulary list where a medication you are taking now is covered. It might not be covered next year. You could have changes to your copays if you're on a Medicare Advantage plan. There's, the changes in the regular Medicare deductibles. So you just want to know what your costs are going to be for the next year. And is there a plan that's going to cover you better next year? With your doctor might not take the plan you're currently on, for example, if it's a Medicare Advantage plan. So it's just good to do a review. Even if you're extremely happy with what you have, you may just stay with what you have. And a lot of people do that review and stay with what they have. But, other people do change, especially the Part D plans, the Medicare drug plans, because they change their formulary list more often where your medications are put into different tiers. Your medication this year might be a tier 1 generic, next year might be a tier 2, and you're paying a little bit more for it. So you just want to know what the costs are going to be for next year.
And I guess, and those can be big numbers, right? I mean, you get one of your drugs that's either goes off the list or moves from I didn't realize how you move from one of these tiers, and your deductible, the amount that you're paying in deductible can be a huge difference.
Yes. Yeah. So the next coming year for 2021, the max deductible they can charge would be $445. And usually that deductible applies to tier 3, which are brand name medications, to up to tier 5. Some are specialty medications. So yes, if you have a medication that is a brand name medication, generally you have to pay that deductible first before you do regular copays. And sometimes plans do change, medications that's this year's in a tier 2, next year's in a tier 3. Now you're subject to that deductible before you have a regular copay. And you might not be aware of that until January. When you go get that medication, you're like, oh, why is that medication so expensive now? When I was only paying $25 last year, for it.
And as
Yeah.
you say, it's a deductible. So you'd be used to going in and paying $25. You could walk in January 1st and you're paying $450
Correct.
because
Yeah,
because you have to work your way through that deductible before you're into the copays. That's a
correct.
huge deal. Yeah,
Yeah.
that's a huge deal.
So that's one of the reasons you want to just make sure, and just relook at it, make sure that, your medications especially are still being covered and you know what you're going to pay for them.
Yeah, Anna, if I may.
Mm-hmm.
Yeah, I had a personal experience with this, more so last year going into the 2020 year. And I won't mention any names, of course, but I had a Part D plan that doubled in premium.
Wow.
Yeah. However, sometimes you have to look at what did it double from. And I think relatively speaking, the plan itself was substantially less than most of the other plans out there. So even though it doubled in premium, it wasn't totally out of the ballpark. The important thing was, though, I have one medication in particular, and again, won't mention names, but it's relatively expensive. Without any plan at all, it's $700 a month, which is substantial.
Yeah.
So after I saw it double, I did do some checking on my own. And what I did was I checked that particular drug. And as it turns out, even with the doubling of the premium, I felt I was still better off with that particular program because with other plans, that particular drug, which is actually a fairly common one and popular one, was substantially more. So at the end of the year, it kind of all washed, and I'm really not paying much more this year than I did last year. So my point, I guess, is you can't look at just the premium, but as you say, if you have all generic drugs, there may not be much of a difference. But if you have one or two relatively expensive drugs, then it would be worth checking to make sure that they're covered in the same manner that your current plan is covering them.
Well, yeah, and that's the good thing with doing like a Shine, meeting with the Shine counselor, doing a review, because that's what we actually do. People can, you couldn't do it on your own on the Medicare.gov website. The only thing is, like, we're used to, we'll put in the medications, it'll come up with what's cheapest based on your medication. So like you're saying, even if a plan might be a higher premium, in the long run, it could save you money, even if you have to pay, say, a deductible in the beginning. So, it does that calculation, and we can check to see if that medication has, subject to a deductible. If it has maybe an alternative medication, you could talk to your doctor about. If you're going to get into what they call donut hole or gap, and a lot of people do. And there are programs out there. If you are, if you have limited income and resources, there are programs out there to assist you with prescription costs and maybe some premium costs. And that's why it's good to meet with a Shine counselor in that area as well, because we also do that intake and review. We kind of go over what is your income, what are your assets in a general ballpark figure, and see if you qualify for any of these assistance programs that you might not even be aware are out there.
So Anna, how are you handling the conversations or the reviews in the age of COVID-19?
Okay, so yeah, generally, what we would do, and this is still the procedure that we're doing right now, you'd call the senior center. So you'd call, 978-568-9638. We do have a new phone system. So you would leave a message either directly, if you know our extensions. Mine happens to be 476. But if not, you just press 0, you get the front desk. You leave a message saying you want to speak to a Shine counselor, your name, phone number, and either myself or Holly or Janice will get back and set up a phone appointment. Right now we're doing phone appointments. It would be the same as the in-person appointment. What we do would take we go over your medication list, what you currently have for your insurance, and then go over what your options would be for next year by phone. It would be a phone appointment this year.
When do you normally start?
The normal open enrollment period starts every year, October 15th, and then you have until December 7th. So the, period is coming up to end. December 7th is the last day to be active on a new plan for January 1st of next year. So, that's when the normal open enrollment period is every year.
Very good. Very good. Thank you, Anna.
And as you mentioned, Anna, you can certainly attempt to go to the Medicare.gov website and figure this out on your own. But that's a real challenge. I mean, I was just listening to another Shine counselor who was talking about the fact that at least her experience has been, there's been a glitch in the program this year on the Medicare.gov, so that if your prescriptions, if you take a medicine once every 2 months instead of once every month, you can't enter it in there. You can't enter it into the program in order to help them do the calculation. But she was like, this is not unusual. And I know I talked to another person who said, has really looks at this with a very jaundiced eye, and says, this is all about the drug companies. They don't want this to work well. They don't want because they don't want you to be looking for another plan. Their ideal business model is that they sell you on a plan, and then they figure you're not going to check every year because you're going to get this big, huge document from your plan provider with this big, huge formulary, and you're going to say, I don't have time. I can't figure this out, And that's how they make their money. And I mean, that sounds terrible, but it's the reason why it's so wonderful that there's actually a program like the one that you guys have all been trained in to help you kind of get a guide through this whole morass,
And if you can't get an appointment, say in Marlboro or Hudson or wherever you are, you can call the Mass Shine program, and they will try to get you in to see a Shine counselor if all the appointments are taken. You can call 1-800-243-4636. That's the Mass, it's the elder phone number where you can get in touch with Shine, with the Shine program in Massachusetts. You can also get in touch with a great program that's Prescription Advantage. That program helps people that are in the donut hole, that get into that donut hole situation. We'll help people certainly do the application if they qualify.
And Anna, can you speak to that program a little bit? Because I think a lot of people hear Prescription Advantage and they mix it up with Medicare Advantage. It would have been nice if somebody had used a different name for this, right? But can you just kind of talk about, related to those issues, to kind of what the donut hole is exactly? I know I learned a new thing this year. I thought I understood the donut hole. I thought it was, you get to a certain amount of money that you've paid, and then after that, your rates go up for a while. But I didn't realize that it was actually, you get to a certain amount, which was your total drug cost, not what you've paid, but your total drug cost. Mm-hmm. And so you can be having very little idea that you're almost at the top of the donut hole because you're paying these little copays, but the drug cost is really high. And then I heard about Prescription Advantage, and it sounds like a great program. When it's just Massachusetts,
Yeah, it's a really great program. It's one of the first programs in the state, actually, Massachusetts, that did this program. So it is weird that all the programs have similar names, and it is kind of confusing because Shine in Massachusetts is the program, but the federal program is called SHIP. So it's like, each state calls it its own name, which it would be just easier if everybody called it the same. But Prescription Advantage helps people in the donut hole. So if you get into the donut hole is between what you're paying for your copays and what the insurance company is paying for your medication. So they're calculating like the total cost of that medication. So once that reaches over $4,020, so the donut hole amount changes a little bit every year, but this year it's reached $4,020, the total cost, you come into this period, which is called, some people call it donut hole, some people call it gap, but it's the same. So then you're paying a percentage based on that total cost of the medication. So like Mr. Parent was saying, if you have a $700 medication total cost, you get into donut hole, now you're paying a percentage when you're in donut hole of that $700, which is like a 25, I believe right now is 25%. So you're paying that until the end of the year. So until the end of the year, and then you start over. So with Prescription Advantage, there is an an income limit, no asset limit. So it's income based only. So it's only based on income. And if you qualify, that'll cap that brand name medication in the donut hole at a max of $30. So Prescription Advantage would pay the rest. So it's a great program. And the income limits are higher than most programs. They have various levels.
Can you give people a kind of an order of magnitude? Because I was amazed when I heard about the income levels. I always think of these, government programs as being, income levels, $10,000, $20,000. But then I heard about these. So
for Prescription Advantage, there's different various levels. They go all the way from they call it in categories from S0 to S5. In the S5, you do have to pay an enrollment fee. So unless you have a lot of prescription costs, it may not be worth it, but we would do that calculation for you. But S4 is the top income limit for free. So it's a free program. And for a couple, you can make all the way up to $4,310 gross income per month and still qualify.
Per month, so about $50,000 a year for a single person.
For a couple.
For a couple, but still for a senior couple. I guess I mentioned that because for my clients, I do nothing but elder law.
Yeah.
That's a big number. I mean, they've got assets that they got their house, they got that other stuff, but to have income that's that high, that's unusual. And
Prescription Advantage doesn't look at assets. You can have, there's no asset test. So, it's income based only. And for one person, for a single person, if you're a single individual, you can make up to $3,190 a month and still qualify for Prescription Advantage. And those rates change every spring. So it does go up a little bit every spring. And Prescription Advantage is, you can apply at any time. So you don't have to worry about like a December 7th or anything like that. It's open any time of the year. It's a great program to have. Even if you don't get into donut hole, you could have it for future, just in case. And it also gives you another advantage of being able to make one-time change outside of open enrollment. So you can get a special period to enroll in a different plan in case you need it during the year.
Right. Anna, let me ask you another question. I just want to, for the benefit of people listening, clarify when you talk about earned income, or income rather. With a lot of state programs, for example, the Senior Circuit Breaker program, it's not earned income, it's total income.
Yeah, it's gross income.
Social Security, everything counts.
Yeah, it's your gross income. So it's not your net income. So it's not a modified adjusted income or anything. It is your gross. So it'd be your gross Social Security.
Right.
If you have a pension, that would count. If you're doing like a monthly IRA, so it's your gross monthly income. But it is very high compared to other programs,
Yeah.
So people, a lot more people may qualify for Prescription Advantage than they think. They might think they don't, but they actually do.
Sure.
So we would, that's one of the things we would look at in a review if you call for a Shine appointment or anytime during the year. It doesn't have to be during open enrollment for Prescription Advantage.
Okay.
And that's another reason why. I mean, you're not going to figure that out on Medicare.gov.
No.
It's a state-funded program. You need to be talking to Anna, right? Or the people like Anna who really know this kind of stuff. So, Anna, could you spend a few minutes I want to make sure we don't run out of time before we talk about this. Can you spend a few minutes talking about Medicare Advantage and about, the point at which or why somebody may want to consider looking at Medicare Advantage, and how do you think about looking at Medicare Advantage versus looking at, your traditional Medicare A and B?
Right. Well, a Medicare Advantage plan, like most of the things you see, like all the advertisements people are getting and see on TV are for Medicare Advantage Medicare Advantage plans, which Medicare says they quote it as Part C, but it's really an optional replacement to your Medicare. So it's companies providing these Medicare Advantage plans. It could be Blue Cross, it can be Fallon, it can be United Healthcare, Harvard Pilgrim. There's a variety of them in Massachusetts. Reason people might want to look at a Medicare Advantage plan is typically, the premiums are lower You have a set copay when you go to a doctor specialist. You have set copays in the hospital or deductibles, so you know what your costs will be. They have some extra benefits built into them that people generally like eyeglass coverage, some hearing coverage, hearing aid coverage. Some have limited dental built into their plan, some fitness benefit reimbursements. They have some additional benefits that regular Medicare doesn't provide. The other thing is, the only thing you have to be careful about with Medicare Advantage and their great programs is that what your doctor takes, because in a Medicare Advantage program, you have to make sure your doctor accepts that plan, especially if it's an HMO, because then you will need your primary care doctor to give you referrals to all specialists, and you need to stay within that circle. So reason people will look into Medicare Advantage, because it's all coordinated into one plan. They know what their costs will be when they go to the doctor or a specialist or the hospital, but you want to just make sure that you're going into a plan not based, like you're saying, solely on like, oh, it's a 0 premium plan or it's a $36 premium plan. You want to make sure you know exactly what you're going to pay, and if your doctor you're seeing takes that plan before you actually enroll into a plan.
Right. And I think that one of the things that's great about all of those plans, though, and of everything you're saying, Anna, is the fact that every year about this time, you actually get to go look in the mirror and say, things are getting worse. The plan that I've been using, my prescriptions are going up, or I've changed my prescriptions. My health might be changing. I might have operations next year. And you get to kind of re-enroll in or find a plan that fits your health that's coming, as opposed to being stuck with the plan that you always had, because you can really actually, on the one hand, I think a lot of seniors think of it as, oh my God, I got to face this again. It's the end of the year. I got to do re-enrollment. But in some ways, it's really a way that you can look at what your health is going to be, which certainly for us, John and I are up there. I mean, you're one of those kids, Anna, but John and I,
I'm getting up there myself.
You're coming, but we worry about this stuff, and you realize that your health can change quickly, and to be able to tailor your insurance and therefore your cost to some of that's a wonderful benefit.
And basically too, a lot of the Medicare Advantage plans, they do have an out-of-pocket limit. So there is an out-of-pocket that, if you run into that situation, this is the most you'll pay for the year, for medical costs. So it's just a good thing to do a review. Your doctor may not take that plan. You may take it this year, not take it next year, because they do negotiate with different plans. So, doctors sometimes change what Medicare Advantage plans they take, and that might be a reason you have to change plan as well. So of course, every doctor, I don't know of any doctor in our area doesn't take like regular Medicare at this point, so if you have just regular Medicare A and B, you can, gives you total freedom to go anywhere you want to go. You can go to any doctor, hospital that accepts Medicare, regular Medicare. So, that's why some people like to do just the regular Medicare option with perhaps a traditional like supplement that supplements the deductibles and copay, the percentages that Medicare doesn't cover, and then a separate Part D plan. So those are kind of the two ways you can supplement your regular Medicare. Either do, regular Medicare supplement in a separate drug plan, or do a Medicare Advantage. What you have to realize with the Medicare Advantage side is that you're actually, even though you have to continue paying your Medicare Part B, nothing is ever going to get billed to Medicare. Everything is going to that insurance company that you have, whether, that Medicare Advantage plan is your insurance, and everything is being billed through them, and your benefits go through them. So, you just need to be aware of that, and that nothing is ever going to get billed to Medicare in that scenario. Right. And you have to follow the Medicare Advantage plan rules, and they have their own drug plan built in as well. So.
Other questions, John?
Yeah. I just want to say to Anna, I'm really glad that you came on the program today. And I think next year I'm going to go through the experts. I think I'm going to give you a call.
Okay. I did actually wanted to mention two more programs though, just for people to be aware out there. There's the federal program which people hear about, which is Extra Help, which also helps you with your medication costs, reducing the cost of your medications. Sometimes it's called LIS, or limited, low income subsidy. It's through the federal government. So that does have income and asset limits. So the federal program has both income and asset limit. And then there's the Medicare Savings Program, was also through Massachusetts, but that program as well, it's called the Mass Health Buy-in. It's not Mass Health Insurance, but it's the Mass Health Buy-in Program or Senior Buy-in Program. Those also have income and asset limits, and those help you with your medication costs as well, lowering those costs. And some of those programs, the Mass Health programs, the buy-in programs, also help you with your Part B premium. So if you are in a lower income situation, the state of Mass would pay for your Medicare Part B in those buy-in programs if you qualify. So, and those.
And if I call you, Anna, I don't have to remember any of this, right?
No.
I can you're just going to figure this all out for me, and you're going to tell me at the end what I do next, right?
Yes. What we'll do is we'll tell you what the guidelines are, the income and asset guidelines for the programs. It's you below these guidelines. If you are and you think you are, we'll help you do the application. The Mass Health Buy-in Program, you can do you can do a smaller application to do the Mass Health Buy-in programs, specifically just for that program. It won't look at all the Mass Health programs. It'll just look at the buy-in program. And then the federal program you can do as well. It's a simple application. We can help you do those applications by mail or online, even, for the federal extra help, you can do it online. So, go ahead.
John, I just want to throw in one other comment, because you're a selectman, right? Those people are unbelievable, right? The people at your senior center, talk about your tax dollars at work, in terms of what they deliver for, because as Anna pointed out, in many communities, the Shine counselors, many of them are 100% volunteer, right? Which is great, except that for volunteers, it's sometimes they just don't have the time, whereas as a result of their doing it year after year, there's so much accumulated expertise, right? That Hudson seniors have as a result of it. It's really something.
Yeah, the senior center is considered by everybody in the town as kind of a jewel, of the town. These are just really good people who help out an awful lot of people. And I want to mention one thing real quick. You read a couple of phone numbers and listed various services. I don't know what month it comes out, but you guys put out a monthly newsletter. And in that newsletter, probably in, I would guess, October, you list the Shine programs, you list the various phone numbers, you list the 800 numbers. So all the information is there.
Yes,
and
thank you. Yeah, the newsletter comes out monthly. It does come out monthly, and during the open enrollment time, we do have a column on the Shine program. There is a form on our newsletter during October, November, December, where you can fill out as well to get a Shine appointment, put in your information, send it back to the senior center, and you can also get an appointment that way. And the newsletter is online through the town. So if you go on the town website, townofhudson.org, and then click to senior center, you can get the newsletters that way. You can sign up online to get the newsletter as well. So you can get the newsletter by mail or online. And so, outside of the Shine program, as we have other programs going on right now. Even though the physical building is closed, we're still doing, all of our work that as best as we can through, grab and go, whether it be like the grab and go lunches we've been having, or, friendly phone calls to people. If you want a friendly phone call, certainly call us and let us know. Whether, just still doing as exercise classes on Zoom. Unfortunately, a lot of stuff on Zoom now, but at least you get to see people in the Zoom environment. And you're still doing the fuel assistance program, which is going on right now as well, for help with your heating. And it's the SNAP program, the food assistance programs. So you know, certainly if you're having difficulties, especially with COVID-19, if you're having food insecurity, stuff like that, you know, give us a call so that we can try to, if we can't help out for some reason, we would certainly direct you to who can in town, you know.
So, and Anna, thanks a million. This has just been terrific. John, thanks a million for doing this and for finding these great guests that we keep finding, right?
Great.
And I guess I would just emphasize to folks, you know, the open enrollment is still open, right? But it's going to close soon. You got to call these people. These people are going to, this is about saving you a lot of money. This is your biggest, one of your biggest expenses, and they can help you. Don't try to figure this out on your own. It's way over all of our heads. Talk to them. All right. So, Anna, thank you so much. Nice to see you.
You too.
And John, always a pleasure. And I think and next month, I think one of our guests is going to be John Parent. I think we're going to be hearing about taxes and some other things next month. So thank you, folks, for watching. And we'll look forward to seeing you on the next installment of Frank and Mary here in Hudson. Thank you very much.
Thank you all.
Thank you.
Have a good day.